Hello. It's really good to be back with you today as Secretary of Agriculture. I remember my first term as Secretary. I had the opportunity very early in that first term to do a WIC announcement to improve the foods that were being purchased in the WIC program. And certainly appreciate the opportunity for receiving the invitation to speak to your conference today. More importantly, I want to extend my sincere thanks to all of you who have been serving your communities in such a remarkable and innovative way during a very difficult circumstance over the past year with the pandemic. I think we all know that WIC is such a vital support to so many moms and infants and children in normal times. The pandemic has only made it clear how critical this program is and continues to be. WIC, I believe, and I think you do too, is one of the most powerful public health interventions available to reduce stark racial disparities in maternal and child health outcomes. This is why the USDA and the Biden-Harris administration are committed to helping more WIC-eligible families access program benefits and investing additional resources to help retain participation the entire time that a participant is eligible. Increased and sustained participation will maximize the program's benefits for this particularly vulnerable population and help America's youngest children get that healthy start they need. And our budget maintains the longstanding commitment we've made to ensuring that we have enough funding to serve every eligible individual. We assure that moms and their young children have the specialized nutrition, resources, and healthcare referrals that they need. And we know this program has proven to have positive impacts for at-risk children and women who are participating. WIC participants are more likely to have a more nutritious diet and better health outcomes. There's strong evidence that WIC participation results in fewer infant deaths, fewer premature births, and increased birth weights, which obviously reduces healthcare costs and saves lives. Participating in WIC also leads to better academic outcomes for our children. Unfortunately, we know that the mortality rates for infants born to Black and Indigenous women are at least twice as high as for infants born to white moms. These health disparities also exist in rates of poor healthcare coverage, higher rates of overweight and obesity, asthma and severe asthma, childhood mortality, and overall poor health. The Biden administration is focused on addressing these disparities. Strengthening WIC and inducing more eligible families to its benefits and services is a proven way to drive better health for infants, more nutritious diets and better health for children, and higher academic achievement for children. We believe that connecting more eligible women and young children to WIC is one of the tools to reduce stark racial disparities in these areas. With about 45% of all pregnant and postpartum women, infants, and young children eligible for WIC, the program has the potential to provide proven benefits to a large and particularly vulnerable population. However, sadly, our latest data shows that only half of eligible individuals are enrolled in the program. And that means that they are not sharing in the participation of the full benefits of the program. And the share of participation in WIC has actually fallen over the last decade. All of us, USDA and all of you, we need to do more to ensure that more eligible people can participate in the program. Fortunately, the American Rescue Plan Act of 2021 included a historic investment in WIC and the WIC Farmer Market Nutrition Program, which USDA will use to improve program delivery and increase participation among eligible women and children. The USDA's Food and Nutrition Service is currently developing a plan for investing the $390 million allocated in the rescue plan through fiscal year 2024, incorporating data-driven strategies to increase program reach and feedback from a diverse set of program stakeholders and advocates, including the National WIC Association and many of its members. Now, this effort is going to include a robust national outreach campaign to ensure that eligible families know about the program benefits and offer new and easier ways for them to enroll. It's also going to encourage innovation to improve service delivery, streamline benefit delivery, and the use of benefits to reduce maternal mortality and morbidity and increase child health by increasing enrollment and retention, by improving the participants' experiences with WIC, by streamlining benefit delivery and services and by reducing disparities in program delivery. We look forward to working with all of you in this important effort. The American Rescue Plan also provides an additional $490 million to help WIC participants purchase healthy foods during this difficult time. These funds will allow WIC state agencies to temporarily increase the cash value of the voucher for purchasing fruits and vegetables. This will last for up to 4 months. The temporarily increased benefit is more than triple the current benefit amount. Now, typically, participants receive a cash voucher of $9 per child and $11 for moms. State and tribal nations that opt in to this temporary increase can provide up to $35 per person per month for up to 4 months. The authority to increase the benefit is available through September 30th of 2021. Now, this increase will help fulfill our administration's commitment to combating both food insecurity and nutrition insecurity amid the COVID-19 crisis. Our budget seeks to build on this progress, started under the American Rescue Plan, by providing more fruits and vegetables to WIC participants and continuing our promotion of greater nutrition security, consistent with the recommendations from the national academies. Now, the work you are doing could not be any more important during this difficult time. You're helping to ensure that our nation's babies are born with the best possible start so they can grow up to thrive and succeed. We look forward to working with you in the years to come to help advance our shared goals. And again, I want to thank you for the opportunity to speak with you today, and best of luck for the rest of the conference.